Hello, welcome to Exposed Teeth. I'm Dr. Rachel Hall. I'm a holistic dentist and I'm the founder and principal dentist at Evolve Dental Healing in Kenmore, which is a suburb of Brisbane. Thank you for joining me live, and if you're watching the replay, then thank you so much. This is my show, Exposed Teeth, and it's where I discuss holistic dentistry, health and well-being and other topics that come to mind. At the moment, I'm focusing on amalgam and mercury, and I've been doing a series on safe amalgam removal, so I'm going to follow on from that. And the title of tonight's Exposed Live is that it's really important to get your amalgam removals done properly and safely and smartly, and get it done once and get it done correctly. So I'll tell you a little bit more about myself while I'm waiting for people to join. I'm the principal dentist at Evolve Dental Healing. I have over 25 years experience, and I've been practicing as a holistic dentist since 2001. Now, I consider myself not your typical dentist because I like to challenge the convention. I want to empower people to ask more questions, to make better dental decisions and health choices. And I've been helping thousands of people over the years have healthy natural smiles. We're just short of removing about 16,000 amalgams on estimate. And I like to write and present on holistic dentistry, health and wellness. And it's my mission to revolutionise the way people think about their dental health. And this is why I have my Exposed Teeth show. I blog, I do a lot of social media. So join in, enjoy the show. If you're watching live, then say hello, say where you're from, and feel free to ask questions or make comments and be part of the show. If there are topics that you'd like to see, then let me know. So I'm going to tell you a little bit about what we do. Well, at Evolve Dental Healing, we provide safe replacement of amalgam mercury fillings, and we do this following the latest protocols and guidelines. Now, why do we do that? Why don't we just drill normally like other dentists? Well, those fillings are 50% mercury, and that leaks out of your filling as you're eating and getting warmth and friction on them. But when we drill them, it releases a lot of mercury. So we want to make sure that we minimise your mercury exposure, and we want to support you, we want to protect your health, and we want to make sure that you stay, have good well-being. So we believe that when you get your amalgams removed, you should do it once and do it right. And that's why we are so detailed in our approach to your dental health and your amalgam removal. So you may be concerned about your health, the condition of your teeth, or even simply just wanting to make your smile look nicer, because after all, having silver and metal black looking fillings is not that attractive, particularly if you've got a wide smile, or if you do speaking or acting, or you're laughing and you're just in the public eye. So for whatever reason you're choosing to replace your amalgams, it's very important that it's done with care and the utmost safety in mind. Stirring up those old amalgam fillings with the dental drill, well, what it does, those drills are going around at 200, lots of revolutions a minute. I think it's 200,000 with my drills, and that creates friction, even with the cold air and the water that we have squirting on them. And that's going to release dangerous mercury vapour up into the air, which with no safety precautions, you're going to breathe that in during the treatment. So the patient, that's you, us, the dentist and the dental team, without specialised equipment, we're going to be exposed to mercury. So we make sure we provide you and ourselves with safety equipment, and we use that every time we drill out an amalgam filling. It's also really important that we understand what's going on with your health and well-being, that any issues you may have with your health that could potentially affect your ability to not only process mercury but to detox it from your system. So for this reason, as a holistic dentist, we're very interested in your dental health but also your overall health and well-being. This is why we insist on having a detailed health history and providing you with a comprehensive free check for your amalgam removal. So we do a consultation, we do a thorough dental examination, we ask lots of questions, and we make sure that you're going to be well and that we can plan your amalgam removal out before we actually do any treatment. So if you're watching live, thank you very much. If you're watching the replay, then I do appreciate it. Please say hello, share, give us some love, let me know you're out there, ask some questions if you want to, and I'll do my best to answer them live. So as a holistic dentist, we carry out a thorough dental examination, and that allows us to know what existing fillings you have, assess the presence of any dental or oral diseases, and also we're going to check for any hidden amalgam, because sometimes you can have had a filling removed, a white filling put over the top, but there's still amalgam filling or bits of mercury filling underneath. We're going to ask that in some cases, if you're not very well, that you see a health practitioner to assess you and your well-being, where you are with your health issues, and make sure you're ready to commence any amalgam removal treatment, because it's important that we get you geared up and ready and that you're able to cope with the detox. So after filling out your comprehensive health assessment questionnaire, that's usually sufficient, but some people want to go and have like a hair mineral analysis test done, look at their body composition, that looks for different metals, different minerals. You can have blood tests, you have saliva testing, urine testing, and so forth. Now these tests give us an overall profile of your health and your mouth, and we know how to best approach your amalgam removal. We know how to deal with your dental conditions, and then we can support you with diet and supplement plans as well. Now, supplementation uses a tried and tested range of vitamins and minerals that have been scientifically shown to be effective in heavy metal detoxification, and we get you to take those in conjunction with the mercury amalgam removal from your teeth. Now, numerous research studies and scientific literature show that your blood chemistries can change when your amalgam fillings are removed. So we must ensure that we perform this procedure very safely and effectively, and make sure that you're taking those specific vitamins and minerals that can protect your body and your cells, so that you can take advantage as well of any further detox. So during amalgam removal, there's 6 stages essentially. Is we get to know you on the phone, assess your needs, get you the right consultation. We get your health history, we do a wellness check of your mouth, we do a thorough amalgam assessment, we get our x-rays and photographs. From there, we'll draw up a detailed treatment plan for you, so you know exactly what's going to happen and the fees involved. We'll also go through your at-home detox, so the supplements and vitamins, and only then do we book time to actually start getting the amalgams out. And once they're out, we like to do a follow-up with you to see how you're going and make sure that you're well and give you any advice that you need. So it's important when we're looking at your fillings to know how many there are, where they are in your mouth, how big they are, the condition of the surrounding tooth and so forth. So depending on the things that we find, that sort of allows us to decide the sequence of removal. And that will vary during individuals. If someone comes in and they're fit and they're healthy, they have no health issues, then we can get cracking and we can get as many amalgams out as closely together as we feel is safe. If someone comes in and you've got a lot of health issues, allergies, chronic conditions, sensitivities, etc., low in energy, and so forth, then we're going to take things a little bit slower to make sure that you and your body can cope with it. In most cases, what we'll do is we'll remove the amalgam in quadrants. So if you think of your mouth as 4 pieces like that, the quadrant will be 1 corner, top or bottom at a time. So we'll do each section of the mouth at a time. Look, if you've got a big volume of fillings or there's a lot on that side, then we may break that up into 2 sessions. Now, the main aim is to safely remove all the amalgams and as soon as possible eliminate the source of mercury exposure, which is the fillings in your teeth, whilst allowing you to maintain the best possible health. So what we do is we'll use our safety equipment. We're what's called SMART certified, and SMART stands for Safe Mercury Amalgam Removal Technique. And that involves the use of a protective rubber dam sheet that goes across your mouth to stop any bits falling in. We give you a separate air supply. We use air filtration. The team wear respirator masks. Now, at our specifically designed office here in Brisbane, All amalgam removals, irrespective, are performed using the rubber dam isolation to prevent the inhalation of mercury vapour through the mouth and stop you ingesting any debris that are created during the removal process. We supply you with a nose mask, and that allows us to administer what's called medical air, and that's just sterile air that you're breathing so that you're not inhaling anything that's going up in the room through your nose. In addition to that, we'll have special devices to prevent the build-up of toxic gases in the dental office, and we'll constantly filter the air in the surgery. In general, once you've had your amalgams replaced, we recommend a follow-up dental visit and a health check, and we'll schedule you for a 6-monthly check and exam. In most cases, we recommend that your supplements are going to be continued for at least 3 months, 6 months, if not longer if you can, because you will have a trickle effect of mercury coming out your body. So you can see why it's important to do this right, do it right from the get-go. I've had a lot of patients come and see me where they say, oh my gosh, I had my amalgams drilled out, I didn't have any safety precautions, I didn't do any supplements, and they got sick. Or, their health slowly deteriorated, and then it was found out that they were very, very mercury toxic and had to go through a very complex and long-winded detox process to be able to get that out. And you wonder how much of that could have been avoided if the right safety precautions were put into place in the first place when they were having their mercury removed. So we want to ensure that you get the best care. So we're going to provide you with a comprehensive amalgam removal booklet that explains about mercury, what it does, about amalgam removal, about having it in your teeth, so you can, be informed and make a better decision. We're going to explain the dietary protocols and the supplementation plan, as well as individually discussing your case in detail. We do that thorough consultation appointment before any treatment is started, so we can make sure you're on the right page, your body's geared up, we know exactly what we're going to do and when we're going to do it. So we're going to then lay out appointment scheduling and the costing fully in advance, so you've got all the information you require to make your choice about whether you go ahead with the amalgam removal or not. Also, you'll understand what's needed to improve your dental care, your health and your smile, and treat any ongoing dental disease that's present. Now remember, you only get one chance to remove your amalgams in the correct way and to maximise the effectiveness of removing those mercury amalgam fillings. So I'm always going to advise that you follow the guidelines that have been trialled, they've been very successful, and then make sure that you avoid any potential risks and get the optimum result. So if you're thinking about getting your amalgam fillings removed, I urge you to do your research, ring around dental practices, ask them questions, ask them what equipment they use, what they do to help you detox, what they're going to do to protect themselves and so forth. So if you'd like to know more about having your amalgams removed, then feel free to ask questions, private message me, ask questions in the comments underneath the video, or if you're really keen to know more, then call us. We'll happily answer your questions. We'll get you scheduled in for your comprehensive amalgam removal consultation. Our number at Evolve Dental Healing is 07 3720 1811. I'm Dr. Rachel Hall. I'm the founder and principal of Evolve Dental. This is Exposed Teeth. Thank you so much for watching live. Thank you for watching the replay. I hope we're giving you a lot of good information on amalgam removal and mercury. I'll be back next week or in 2 weeks' time, depending on my schedule. So thank you very much for watching. We'll see you soon.